What is the Massive Transfusion Protocol? The Massive Transfusion Protocol, or MTP for short, is the transfusion of a 1:1:1 ratio of packed red cells, fresh frozen plasma, and platelets. It is an adjunct used to address the C for circulation aspect of the trauma protocol or resuscitation of acute blood loss from other reasons. Although the specific protocols for MTP may differ slightly across different situations, the overall idea is the same. MTP is there to save lives. The indications for activation of the MTP include managing immediate acute blood loss if over 4 packed red cells are required immediately or if over 10 packed red cells are expected in the first 24 hours. Maintaining hemodynamic stability if the systolic blood pressure is less than 110 millimeters of mercury, heart rate is greater than 105 beats per minute, the hematocrit is less than 32%, or the pH is less than 7.25, and in difficult to control injuries. The end targets of the MTP are to correct the lethal triad of hypothermia, acidosis, and coagulopathy. Specifically, correcting hypothermia to a temperature of greater than 35.0 degrees Celsius, correcting acidosis to a pH of greater than 2, base excess of less than -6, and lactate of less than 4 millimoles per liter, and correcting coagulopathy to an ionized calcium greater than 1.1, platelets greater than 50, INR less than 1.5, APTT greater than 1.5 times normal, and fibrinogen of less than 1.0. These represent the lethal triad of uncontrollable bleeding. The correction of coagulation can be further targeted by the use of TEG or ROTEM, which allows for the targeted correction of the clotting cascade. In addition, tranexamic acid can also be used to reduce bleeding. Tranexamic acid is given as an initial 1 gram infusion over 10 minutes, followed by a further 1 gram infusion over 8 hours. The CRASH-2 trial demonstrated that the use of tranexamic acid within 3 hours of injury reduces risks of death from bleeding, and the CRASH-3 trial demonstrated that the use of tranexamic acid is safe even with brain injury. Whilst the MTP is extremely useful, it needs to be used alongside an effective trauma resuscitation. This type of trauma resuscitation should follow the EMST or ATLS protocol of A, B, C, D, E, being airway, breathing, circulation, disability, exposure. Specifically, within the C for circulation aspect of trauma, the goals are to minimize blood loss with binders, tourniquets, and direct pressure. Resuscitate with blood by maintaining oxygenation and activating the MTP. Allowing permissive hypotension with a systolic blood pressure of 80 to 90 millimeters of mercury, except in head injury, where the target is a mean arterial pressure of greater than 80 millimeters of mercury, or a systolic blood pressure of 100 to 110 millimeters of mercury. Correcting the lethal triad of coagulation, hypothermia, and acidosis, and ensuring early surgical intervention with hemostasis and control of contamination, often involving damage control surgery, relook, and delayed definitive management. Thank you for watching. If you like this video, please like, subscribe, and comment for more videos.